Hey everyone, it's your pal Dr. Mark, and we're back with another episode of RxTales. This time, it's Cocaine Part 2, The Return. You may have noticed, I got my white coat now, huh? And different merch. So, in today's episode, we're gonna build on what we talked about in the first part and take you through another section of history of the fascinating world of cocaine. Now, if you're just starting out, I highly recommend you go back and watch episode 6. That talks a lot more about the chemistry, pharmacology, and ancient history of the coca leaf and its impact on human culture. Today, we're gonna pick back up where we left off and tell the story of how, in the 1800s, coca becomes cocaine. And it's a wild ride, so buckle up. So, in the 1800s, the science of organic chemistry is really coming into its own. And what it's doing is turning old plants into new drugs, like morphine, quinine, and aspirin. Not to mention the first early synthetic drugs, like chloral hydrate and nitrous oxide. And by the 1850s, the Industrial Revolution was in full effect and ready to turbocharge drug production and distribution on a scale that had never been seen before on Earth. Oh yeah, I should probably point out that all of this innovation, for the most part, was happening in Europe. With its massive colonial empires, extreme wealth, and universities that dated back to the Middle Ages, Europe was the world leader in pharmaceutical research and manufacturing throughout the 19th century. The US wasn't quite there yet. We'll talk more on that in a bit. In the 1850s, the race was on in Europe to discover and isolate the secret chemicals inside the coca leaf. But why such a big deal? And why now? Well, because morphine. Okay, before we get too far along, a really quick sidetrack. Morphine was isolated from opium for the first time around 1805. However, this was just a single experiment in a lab. To get from this stage to mass production at scale, that took about 25 years. Morphine became really popular in Europe, but then in 1853, a new invention changed the game forever: the hypodermic syringe. With the introduction of the syringe, drugs could now be administered directly into the bloodstream. Now, this does two things. Number one, speed. There's no more delay in waiting for drugs to make their way to the small intestine to get absorbed into the bloodstream and take effect. Intravenous, or IV drugs, flood every cell in the body within seconds. Number two, strength. So when you take a drug by mouth, it has to run through a chemical gauntlet that can drastically reduce the amount of drug that gets absorbed. The stomach is basically a big bag filled with hydrochloric acid, which then leads to the duodenum, the first part of the small intestine, where the pancreas secretes an arsenal of digestive enzymes. So of the amount of drug that remains after all of that, the amount that actually gets into the bloodstream can vary considerably depending on the drug. Basically, IV administration is the gold standard for putting a drug into the body. Morphine went from being just a cool new derivative of opium to the most powerful drug on the planet. As you can imagine, shooting up morphine through a syringe became incredibly popular almost overnight. But as you know, this is not a good thing, followed by widespread morphine addiction in Europe. Bad, right? But what if there was a cure? Some type of anti-morphine that could counteract the sleepiness and fierce cravings for this addictive drug. Now you have to remember, at the time in the 1850s, medical science was still a far ways off from what it is today. Exactly how drugs work was still pretty much a mystery. And it's for this reason that coca seemed like a perfect remedy. Its stimulant effect made users wide awake and alert. Perhaps, they thought, this could be the cure for morphine addiction. Spoiler alert, it's not. But they didn't know this at the time. So the race was on to discover coca's chemical secrets. So here we go. Like I said in the last episode, aside from a few sporadic accounts of Europeans who had traveled to South America, coca was pretty much off the radar in the Western world until the 1850s. And that's where our story begins. Yay! All right, let's get the timeline up here, because this is going to be really important. We're going to have a lot of overlapping details, and I want to help you keep it straight. Our story begins with a young Italian physician named Paolo Mantegazza. After graduating from university in 1854, he took off to South America, where he worked as a doctor, traveling around to small villages in Argentina and Paraguay. Now, Paolo Mantegazza was a prolific writer, and a lot of other things. We'll get to that in just a minute. In his diaries and letters from the time, he writes extensively about how the comparatively warm climate made him feel lethargic and weak. Dude, maybe you're just a wuss. There's actually more to it, and it's unfortunately pretty racist. Our boy Paolo was heavily influenced by a theory called environmental determinism, which is basically the idea that cold climates tense up the body and make people more rational, energetic, strong, courageous, resilient, and hardworking, while warm climates relax the body, making people lazy, less intelligent, weak, indecisive, and emotional. You see where this is going? And who came up with all this racist bullshit? This guy, Charles Montesquieu. So Montesquieu was a political philosopher from the early 1700s who also came up with the idea of governmental separation of powers. He was also a big influence on the founding fathers of the United States and the Constitution. Surprised? No, you're not. Anyways, while he's in South America, Paolo Mantegazza gets introduced to coca sometime around the winter of 1856 to 1857. Now, he doesn't just try it. He goes all in, performing some very scientific self-experimentation with coca, and writes about it in the most objective and rational terms. Check this out. I sneered at the poor mortals condemned to live in this valley of tears, while I, carried on the wings of 2 leaves of coca, went flying through the spaces of 77,438 words, each more splendid than the one before. An hour later, I was sufficiently calm to write these words in a steady hand. God is unjust because he made man incapable of sustaining the effect of coca all life long. I would rather live a lifespan of 10 years with coca than one of a bajillion centuries without coca. Yeah, totally not an early coke fiend. Let's leave Mantegazza in South America for right now. Now, we will come back to him in a bit and turn our attention to Germany. 1855. A guy named Freidrich Gaedcke, a German chemist and pharmacist. Gaedcke was the first person to extract and isolate pure cocaine from the coca leaf. He called his discovery erythroxylin, and he published a short journal article on his findings. And the story of cocaine might have ended there, but this was not the case. Gaedcke's work was read by one of the, perhaps, most brilliant chemists of the time, a man named Friedrich Wohler. Friedrich Wohler, or F-dubs, was absolutely brilliant. He was a superstar in chemistry in his own time. People traveled from all over Europe and really all over the world to come and study under him and learn what he knew about chemistry. And the dude had receipts to back it up. He had written over 275 papers and books and studies on all sorts of topics. He invented organic chemistry. We could go on and on about Friedrich Wohler, but here's how it ties into cocaine. In 1857, an Austrian ship called the Novara was setting sail for the Americas as part of a scientific voyage around the globe. Now, Wohler had connections to the scientists who were running the expedition, and he asked them a favor. He said, hey, when you guys stop by South America, I want you to bring me back a whole bunch of coca leaves, because I'm going to do chemistry on it. The scientists said, sure, and off they went. Let's get back to Paolo Mantegazza. In 1858, he comes back to Italy from South America, and he writes his first landmark publication. It's called On the Hygienic and Medicinal Properties of Coca and on Nervine Nourishment in General. This was a huge publication. This was incredibly popular at the time, and it stirred up a lot of interest in coca in the European scientific community. I'm sure it had nothing to do with the fact that a coked-up Mantegazza wrote an insanely hyperbolic narrative about how coca was the greatest thing ever in the history of mankind. Paolo Mantegazza would go on to become a famous Italian surgeon and neurologist, an anthropologist, politician, novelist, racist, and coke-fueled sex fiend. It's worth noting he also practiced vivisection. You do you, Paolo. Moving on, let's get back to Germany. In 1859, the Novara returns to Europe, and Friedrich Wohler gets his massive shipment of coca leaves. And he does what any great scientist would do. He gives the coca leaves to his grad student, Albert Niemann, for further research. Here, go study this. So Albert Niemann, along with his colleague, Wilhelm Lossen, not only reproduced Gaedcke's work, but improved upon the extraction process. And it's Albert Niemann that came up with the word cocaine, or cocaine, to describe the brand new substance. His work on the subject, called On a New Organic Base in Coca Leaves, was published in 1860, and it earned him his PhD. Now, Niemann was another brilliant chemist, and he really should have stopped there and quit while he was ahead. Unfortunately, he died in early 1861 as a result of toxic exposure during his next project, which was working on mustard gas. So after Niemann's death, Wilhelm Lossen continues his work. He continues to study cocaine, and by 1862, he had figured out its chemical structure. In 1862, that same year, the German pharmaceutical company Merck began producing cocaine for commercial use. This was a difficult process because the leaves would often deteriorate during the months-long voyage from South America back to Europe. Because of this, Merck only produced about 50 grams of cocaine annually during those early years. All right, we need to move over to France for this next one. In 1863, a French pharmacist named Angelo Mariani starts producing a Bordeaux wine infused with coca leaves. It will probably not surprise you that Mariani was inspired to develop a coca concoction because he was fascinated with the writings of Paolo Mantegazza. Yes, I know. He calls his product Vin tonique Mariani à la coca de Paris, or simply Vin Mariani. It was a massive success. Cocaine and alcohol are a very potent pharmaceutical combination. So when cocaine and alcohol are present in the body at the same time, the alcohol interferes with the normal metabolism of cocaine in the liver. This mix-up results in a process called transesterification, by which a new drug is formed, coca-ethylene. Now, coca-ethylene basically turbocharges the effects of cocaine, making them more powerful and longer lasting. And that's not a good thing when we're talking about cocaine. Alcohol mixed with cocaine is way more dangerous than cocaine by itself. It's actually about 18 to 25 times more likely to cause immediate death. But Van Mariani was made with coca leaves and not with pure cocaine. So the amount of cocaine that you would find in a given batch really varied from bottle to bottle. Remember, extracting cocaine from the coca leaf was a really limited process, and there isn't a big supply on the market yet. So Van Mariani was the primary way that cocaine was consumed by the public in Europe during the 1860s and 70s. And it's huge. There's really no way to describe how popular this stuff was. You can see this is my Coca Mariani bottle. Mariani was excellent at marketing. He advertised in all the newspapers, and his biggest flex was a slew of testimonials from the world's most famous people at the time talking about how great this stuff was. Mariani's ads are basically a who's who of every celebrity from the late 19th century. So it started out with opera singers, basically the Taylor Swifts and Charlie XCXs of their day, who endorsed Van Mariani for its soothing effect on the vocal cords. But it didn't stop there. Here are just a few of Coca Mariani's biggest fans. Alexander Dumas, Jules Verne, Thomas Edison, Queen Victoria, Empress Catherine the Great, U.S. presidents Ulysses S. Grant and William McKinley, Auguste Bertoldi, the guy who designed the Statue of Liberty, John Philip Sousa, and two popes, Pope Leo XIII and Pope Pius X. Pope Leo XIII was a huge fan of Van Mariani, perhaps its biggest fan. He carried a small bottle of it wherever he went so that, he could take a hit whenever, in his words, when prayer was not sufficient. He not only consented to the use of his image in an advertisement for Van Mariani, but he also awarded Angelo Mariani a papal gold medal. His Holiness the Pope writes that he has fully appreciated the beneficent effects of his tonic wine and has forwarded to Mr. Mariani, as a token of his gratitude, a gold medal bearing his august effigy. Sounds important, right? Now, you'll notice there was a couple Americans on that list. We'll get into that in the next episode. Let's get back to the science. So, the first true scientific studies of cocaine on living organisms were performed by Thomas Moreno y Maiz between 1865 and 1868. Maiz was a Peruvian physician who received his training in Paris. His research, which involved injecting rats, guinea pigs, frogs, and a bunch of other animals with cocaine, showed two things. One, that cocaine was a powerful anesthetic, and two, it could be successfully administered by injection. The first human studies on cocaine's medicinal effects were published in 1880 by a Russian pharmacologist named Vasily or Basil von Anrep. Now, using himself as a test subject, von Anrep described how cocaine blocked pain sensations and caused a profound numbing sensation on the tongue. It was Basil von Anrep that first suggested that cocaine could be used for surgical anesthesia in humans. Another early human experiment was performed by Theodor Aschenbrandt, a Bavarian army surgeon, who spiked his soldiers' water supply with cocaine to observe the effects. And guess what he discovered? The drugged-up troops had a lot of energy and didn't feel hungry. Aschenbrandt wrote a scholarly article on this in 1883, and one of the people who read it was a 28-year-old German physician who along with a few of his colleagues, launched cocaine into superstardom. His name was Sigmund Freud. After reading Aschenbrandt's article, Freud became really interested in cocaine's potential for its medicinal effects. And in his research, he comes across a publication called the Detroit Therapeutic Gazette. What Freud didn't realize or know at the time was that the Detroit Therapeutic Gazette was a self-promotional publication that was put out by Parke-Davis, a drug company based in Detroit, to specifically advertise its own products. Again, there's no rules about having to be ethical or honest in clinical literature at the time. So it's basically a commercial. And one of Parke-Davis's biggest products was, you guessed it, cocaine. So Freud is reading all of these articles talking about how cocaine is just like the best thing ever. And I mean, he is swayed by the advertising. So Freud begins using cocaine in 1883, for science, and published multiple papers recording his observations, suggesting that cocaine was some type of wonder drug and could be used to treat all types of physical and mental illnesses. Now, it was Freud who was among the first to seriously suggest that cocaine could be used to treat morphine addiction. It just so happened that his good friend, Austrian physician Ernst Fleischl von Marxow, or Marxow von Fleischl, depending on who you ask, we'll just call him Ernie for convenience. Ernie was an ideal test subject for this new theory. So back in med school, Ernst Fleischl von Marxow, Ernie, had accidentally sliced his thumb open while dissecting a corpse. Ouch. Which became infected and had to be amputated. This injury left him in chronic severe pain, so he began using morphine to treat that pain, which was the best thing they had at the time. Unfortunately, that soon developed into a full-blown opioid addiction. In 1884, Sigmund Freud advised his friend Ernie to start taking an oral solution of cocaine to help with his morphine cravings. Now, this was not a good idea. At first, it seemed like the treatment was working for like a day. His morphine cravings were diminished for a very short period of time, but it soon became evident that this experiment had gone horribly wrong. Within just a few days, Ernie's cocaine use had rapidly increased. He consumed so much of the drug that he went into a cocaine-induced psychosis, hallucinating that he had snakes crawling all over his body. Cocaine was not the cure that Freud hoped it would be. Not only was Ernie still in extreme pain, but now he was also going through opioid withdrawal. Less than 2 weeks after starting the cocaine treatment, Ernst von Fleischl-Marxow underwent another surgery on his amputation in a desperate but unsuccessful attempt to relieve his unbearable pain. And he soon started using morphine again. I mean, this is how it goes, right? Ernst von Fleischl-Marxow did not recover from morphine addiction. Instead, he was now addicted to both morphine and cocaine. He soon began injecting both drugs regularly, like every day, becoming hooked on one of the most powerful drug combinations ever discovered, basically speedballing his way to an early death in 1891. It's sad. Sorry. Pour one out for Ernst von Fleischl-Marxow. So, did Freud feel guilty about what he did to his friend? Yeah, he did. However, did he lie about cocaine's effectiveness as a treatment for opioid addiction? Also, yes. In the summer of 1884, while Ernst von Fleischl-Marxow was descending into an addiction spiral, Freud published his seminal work, Über Coca, or On Coca, which became massively influential in promoting cocaine use both in Europe and the United States. Freud shared his love of disco dust with just about everyone he knew. One of his colleagues was an ophthalmologist named Karl Koller. Now, Koller had been conducting experiments on lab animals, trying to find a suitable anesthetic that could be used for eye surgery. I mean, so far he had tried like morphine, ether, chloral hydrate, and nothing worked. In 1884, Freud was like, hey, you know what you should try? Is it cocaine? Hell yeah, it's cocaine! This actually wasn't a bad idea. The numbing properties of cocaine were exactly what Karl Koller was looking for. Using himself as a test subject, he put a few drops of cocaine solution into his eye and, looking in the mirror, poked his eye with a pin. He felt nothing. It was a breakthrough. His experiment proved that cocaine was an effective numbing agent and could enable him to do cataract surgery and other medical procedures that required sticking sharp things in the eye. And it wasn't just him. In addition to Karl Koller, several of Freud's other colleagues also published papers in 1884 describing cocaine's anesthetic and numbing properties when applied to the ears, nose, mouth, trachea, rectum, and genitals. Seriously, guys, is this the best use of your time? 1884 was a huge year for cocaine. We're going to talk about 1884 a lot. Let's now jump to the United States for just a minute. I want to talk about two physicians, a team of doctors named Richard Hall and William Halstead. After reading Karl Koller's research, these two doctors became very interested in cocaine, and they wondered if it could be used for other surgical procedures. And just like their German counterparts, they began experimenting on themselves. You know, for science. Using injections of cocaine, Dr. Halstead pierced Dr. Hall's lip and hammered on his teeth painlessly. They discovered that injected cocaine could effectively turn off an entire nerve branch. They performed over 1,000 minor surgeries using injected cocaine in the mouth, arms, and legs. One of the best uses they found was for tooth extraction. Before cocaine, going to the dentist was literally medieval torture. Now, it will probably come as no surprise to you that both Dr. Halstead and Dr. Hall, they both became addicted to injecting cocaine, along with a bunch of their colleagues. Again, this is not good. In 1885, a coked up Dr. Halstead published a rambling, incoherent article in the New York Medical Journal. In 1886, Dr. Richard Hall performed the first successful appendectomy, appendix removal, high AF on cocaine. Look, addiction is not a joke. I'm trying to be entertaining and engaging here, but being addicted to cocaine is not funny. Both Dr. Halstead and Dr. Hall became unmanageable cokeheads. Their increasingly erratic behavior led to them both being hospitalized over and over. Dr. Halstead, he had a friend that literally had him kidnapped and put on a ship for several months to try and keep him away from cocaine so that he would detox at sea. That didn't work. When he got back, he begins using cocaine again, and then he also started using morphine to treat his cocaine addiction. This also didn't work. He did give up cocaine eventually after a 9-month stay in a sanitarium, but he spent the rest of his life addicted to morphine. Dr. Hall tried to beat cocaine addiction by moving to the West Coast, but unfortunately he never recovered. Ironically, he died from a ruptured appendix in 1897. The final pair of scientists on this extremely insane timeline is August Bier and his assistant, Augustus Hildebrandt. Dr. August Bier is often referred to as the father of modern anesthesia. In 1898, Bier performed the first successful spinal block by injecting 15 milligrams of cocaine directly into the spinal fluid of a patient. It worked. I mean, the patient was conscious, but completely numb from the waist down. After a few of these procedures, August Bier decided to try it on himself. For science. Allegedly to confirm the nauseating after effects of cocaine spinal injections. Yeah, right. So, first, one night, Dr. August Bier had his assistant, Hildebrandt, inject his spinal column with a solution of cocaine. Unfortunately, Hildebrandt effed it all up, spilling cerebrospinal fluid and cocaine all over the floor. You had one job, Hildebrandt. Pathetic. So, later that evening, Bier tried the experiment on his assistant. After receiving the cocaine spinal tap, Hildebrandt couldn't feel his lower half at all. To confirm this, August Bier applied a series of otherwise painful stimuli to his assistant's numbed up body. You know, for science. So first, he tickled Hildebrandt's feet. Nothing. Then, a few pinpricks. Nope. No feeling. Next, he made a small incision on Hildebrandt's thigh. Now, if you're squeamish at all, I'm going to give you a chance to pause the video and fast forward. You may not want to watch. So the rest of this, it's going to get pretty bad. So I warned you. Next, into that incision, he inserts a long needle and starts probing around inside Hildebrandt's thigh. Hildebrandt can't feel a thing. He pushes the needle all the way down to the bone. Nothing. Hildebrandt's still smiling. It's like, yeah, I can't feel a damn thing.
I'm Dr. August Bier. I do cocaine.
Okay, so Dr. August Bier starts to up the ante a little bit. He takes his burning cigar and puts it out on Hildebrandt's leg. No pain. All right, now for some really painful stuff. He hits him on the shins with an iron hammer. No pain. He then tries plucking out Hildebrandt's pubic hairs, one by one. God. But nope. Hildebrandt feels nothing. He even grabs Hildebrandt's testicles and applied, quote, strong pressure and traction. Basically squeezing and yanking really hard on his assistant's balls. You know, for science. To both of their astonishment, Hildebrandt, through all of this torture, feels nothing whatsoever. Afterwards, they celebrated by having a nice dinner together and sharing some wine and cigars. You know, we can laugh about it now. Man, things were different in the 1800s. You know, this is why we have to watch those HR videos today. Because of stuff like this. All right, now that you're sufficiently traumatized, I'll go ahead and sign off the episode. I'm really glad you guys stuck it out to the end. Thank you so much for watching. If you liked this, please go back and check out some of my other videos. And definitely hit that subscribe button because you're not going to want to miss part 3, where I talk about cocaine's impact in the United States in the 1800s. This was a lot of fun. I had a great time making this video. Please, again, share it with a friend, hit that subscribe button, stay tuned. Don't forget to ask your pharmacist, and I will see you next time on RxTales.